Hello, welcome back. The topic today is obesity and insulin resistance. So we all know what is diabetes, but diabetes is mainly because of low insulin level secreted to the pancreas. So the sugar level increases, that's called diabetes. But what is insulin resistance? Especially in type 2 diabetes, most of the people have adequate insulin or even excess insulin, but they are not effective. There will be insulin, but it won't be working well to reduce the blood sugar. That's called insulin resistance. So the function of the insulin is mostly in the three areas. One is the fat and muscle, where the insulin pushes the glucose into the cells, and the other area is the liver, where it prevents nocturnal, the nighttime output of the sugar. It prevents sugar output in the nighttime. But in insulin resistance, the reverse is happening. So from the fat and muscle, the glucose is coming out, goes to the bloodstream and increases the blood sugar. And the night time, it will not prevent the excretion of glucose from the liver. So the glucose enters into the bloodstream and increase the fasting blood sugar. So this is how you can easily know whether somebody has an insulin resistance is. They will come and say, doctor, I'm taking medicine properly, I'm doing exercise, I'm not at all eating any sweets, I follow the diet what you prescribe, but in spite of that my sugar is erratic, and especially the fasting blood sugar is very high. So this is the first thing we'll come to know that somebody has a insulin resistance. So when there is insulin resistance, the treatment entirely differs from others. So who else, what are the other signs that we know insulin resistance? First is obesity, especially central obesity. The waist circumference, is very big, and they have a overweight or even obese. They have hypercholesterol, especially triglycerides. Fasting triglycerides are very high, and fasting HDL, the good cholesterol, is very low. Hypertension, all these things plus, and usually they get a lot of skin tags, like pimples, kind of skin tags in and around the neck, in the back, and velvety black patches, especially in the neck area, axilla, the waist area, and inner thighs. Patchy black velvety changes. These are the signs that shows insulin resistance. Okay, who are all predisposed or exposed to this insulin resistance? If you are above 45 years, and if you are overweight, especially BMI more than 32, and central obesity, and people taking too much of carbohydrates and sugary food, Pepsi, Coke kind of sweets kind of thing, and who are not doing exercise, sedentary lifestyle, and gestational diabetes. So during pregnancy, if somebody is having sugar, usually it corrects itself after some time, but in future they'll get diabetes. That time insulin resistance is very high. Or those people who are taking medications for psychiatric complaints, those who are taking medicines for steroid medications, they are prone for insulin resistance. Or those who are having Cushing's syndrome, like diseases, or PCOS, especially women who has PCOS, they are more prone for insulin resistance. Okay. What is the complications or we can get because of the insulin resistance? One is, of course, the sugar may be erratic, the sugar control may not be proper, poor diabetes control. That's the first thing. They can get kidney disease, eye problem, chances of getting more cancer. These are the complications of the insulin resistance. Okay, how to treat? This is very important. How to take care of the insulin resistance? The first and foremost is reduce your weight. Whatever the weight, at least lose weight. 10% of the body weight has to be reduced. Number one. Number two, reduce your hip size. The maximum allowed for Indian male is 90 centimeters, and for female Indian is 80 centimeters. So keep your hip size or the waist circumference to maximum 90 for male and 80 for females. The third is healthy diet. Avoid carbohydrates, avoid sugary sweets and everything, and probably these people can be benefited with intermittent fasting, paleo diet. All these things can help them. So healthy diet, more vegetables, more fruits, and less calorie diet. These one. And of course exercise. Exercise is very important. Minimum 45 minutes of brisk walking. Minimum. If you are younger, maybe other exercises are really encouraged, but for all ages, minimum 45 minutes of brisk walking. And of course, get a opinion from the doctor whether to take some medications like metformin, especially if you have a PCOS or you're taking steroid medications, the doctors can prescribe some medications. So insulin resistance is where insulin is adequate or more, but it's not working at all. So the sugar is not under control, leading to other complications. So if you have insulin resistance, ask your doctor. Probably will help you with some medications and lifestyle changes, and it can be kept under control easily. Thank you.